all of the data from there, because you'll see their urine flow is great, but they're just peeing all the time. And you start to utilize it as a bladder training, device more than anything.
Yeah. Yeah. That's really neat. Did have some questions coming in here, so I want to run through some of those. Ron Gracilla on YouTube said, I've been using it for 2 months. It's super easy and also gives trends of volume and flow over time.
Yeah. Awesome.
Which is
Thank you.
unheard of doing a urodynamic study. You're not going to get trends.
Yeah. And so like, I was an ICU nurse, the bulk of my career. So one thing, if I have any ICU nurses on here, is intake and output, right? So you have catheters, you have, all the fluids you put into the patient. So intake and output was kind of like my thought process, even going into urology. And whenever I'm trying to figure out, are these patients having some mismatch there, they you can really utilize that. So a lot of times, I'll have my patients do a bladder diary, right? And so again, I think I mentioned it, even during my presentation, these patients that are drinking a gallon of water, I mean, they're going to be peeing all the time. And, it's what you put in is going to have to put out, or you want it to come out. So that's where those volumes can really kind of shine a light. Hey, is this a problem that you're doing to yourself? And then you can manipulate that problem at the house.
Yep, absolutely. One of the things I find that's probably the most underutilized and probably gives you the most information is a simple bladder diary.